Hello students, welcome to EPG Pathsala. I am Abhishek Thakur, currently teaching in Department of Social Work, University of Delhi. Today we are going to talk about drinking water, community and public health. After completing this module, you will be able to learn the relevance of drinking water, the issues related to drinking water and impact of drinking water in public health. Now before we get into the module, I wanted to discuss that why the relevance of drinking water here is important to understand. You will be surprised to know that in developed countries there are 33 diseases because of which most of the deaths takes place. And out of these 33 diseases, 21 diseases are related to drinking water. So drinking water's relevance becomes very important in current context to understand. The different issues, the another objective of this module is to understand different issues with regards to drinking water. In Indian context, if we talk about, we have different caste, class and economic background of the people. And the access to water is generally dependent on all these parameters. The caste-based discrimination, the economically poor people are not able to afford safe drinking water and so on. The third is to understand the public health, impact of water on public health. Public health, as estimated by WHO, 1/3 of global disease can be prevented if we do better interventions in safe drinking water. So that's how the impact of water on health is very, very important. And if the country wants to remain healthy, we need to have a better interventions. We have to plan good interventions in the sector of drinking water.
Let's talk about something about water rights and access. The United Nations declared the right to water as a fundamental right under the right to life and placed several obligations on the states. Citizens are entitled access to safe, sufficient and affordable water. The minimum water supply to individuals should be 20 liters per day and be appropriate from the health point of view. Importantly, access to water should be non-discriminatory, afford equality and have preferential attention to the deprived section of society. India also recognized the right to water. Article 21 of Indian Constitution outlines the right to life with dignity. A dignified life includes access to pollution-free air and water and environment conducive for good health. On the basis of such legal provisions, the Supreme Court of India has upheld access to clean water as a fundamental right and directed state governments to protect water resources from contamination and ensure access to clean water. However, despite the UN Declaration on the Right to Water, Article 21 of Indian Constitution and the various judgments passed by the Indian judiciary system, there still remain multiple challenges regarding access to clean, sufficient and affordable water. In a country like India, it is a depressing scenario that a majority of the population does not receive adequate drinking water. There are different hidden issues why that segment of population does not get the adequate water. Firstly, there are number of water resources such as wells, taps, hand pumps, river, ponds, lake and so on, but it is not possible to maintain the cleanliness every time. Due to absence of clean water, there is onset of various diseases in their life. Importantly, it should be noted that water related disease depend upon the living condition of the individual. Another important aspect is the degree of awareness among the people regarding water and sanitation. Due to lack of awareness and safety measures, people are easily affected by some dangerous or incurable waterborne diseases. Even though all human beings have right to life, right to development and right to equality etc., these fundamental rights cannot be fully realized unless people have access to safe drinking water and basic sanitation facilities. Constitution of India identifies the provision of safe drinking water for its citizens. The Constitution of India has sustained the rights of Indian citizens to get access to clean drinking water as an important component of their fundamental rights. Further, the apex court has also directed the respective Indian state governments to provide pure and safe drinking water to the people. Let us talk about the importance and scarcity of water. Water being one of the most remarkable substance, its access and distribution needs to be understood from different perspectives. Its uses in different forms is non-comparable to any other matter due to its unique characteristics in the lives of any being. Interestingly, even today there is a need to see the significance of safe water in different remotest areas of the world. Water being the major source of energy in most countries is also crucial for sustainable development. Over the years, the challenge of meeting this essential requirement has increased to a great extent. Apart from varied requirements, water at the foremost is very essential components for living the life. Water is the most urgent need required in the daily activities. In fact, water has the multiple functions for the living beings, starting from the cell life to the elimination of waste. The significance of water can be seen in different areas such as for irrigation, agriculture, industrial, drinking and sanitation purpose and so on. Globally, the condition of drinking water is quite uneven, disproportionate. Where 85% of the world population lives in the driest half of the planet. About 66% of Africa is arid and semi-arid, and more than 300 of the 800 million people in sub-Saharan Africa live in a water scarce environment, which means that they have less than 1000 m³ per capita. 783 million people do not have access to clean water and almost 2.5 billion do not have access to adequate sanitation. 6 to 8 million people die annually from the consequences of disasters and water related disease. Over the half of the world population lives in urban areas and the number of urban dwellers grows every day. Urban areas, although better served than rural areas, are still struggling to keep up with population growth. At one point, major section of the rural people are not getting proper access to safe drinking water, and on other end the urban population is getting mainly better facility, but not very accurately safe. Let us talk about a few factors influencing access to drinking water. It is imperative to understand the conditions of accessibility to water to the beneficiaries. As Kulet 2011 mentions in his analysis that the fundamental right to water was established after the Indian independence, and it reflected quite well in the policies and programs brought by the government over the period of time, but this right has not been elaborated in the judicial decisions. Interestingly, there is no general drinking water legislation in India which compels state to provide safe drinking water to its citizens of the country. Though the Article 47 of the Indian Constitution mentions the duty of the state to provide and improve public health and raise the level of nutrition, but absence of any legislation on safe drinking water, which is crucial to public health, confines us in achieving the goal of improving the public health standard. Moreover, in a country like India, it is a depressing scenario that most of the population does not receive adequate drinking water at all. There are various issues why certain segment of population does not get the adequate water. maybe because of due to absence of clean water, maybe there is entry of various kinds of diseases in their life. Various scholarship shows that there are different water related disease in developing countries, starting from the source to the point of use. Inequities among population, communities perspective. This is the area where we should discuss very briefly. The access to water is influenced by an array of factors. Infrastructure is one of the relevant keys to the delivery of water, irrespective of consumers paying for it or consuming it as a free commodity. By infrastructure, we refer to structures such as dams that harness water, the equipment that is required to purify the water, and the necessary distribution mechanism to bring the water to the end user. However, irrespective of proper infrastructure, various socio-economic factors affect smooth accessibility to water. Empirical evidence also from various official sources reveals that access rates to water below expected standards, and that too skewed in favor of urban areas only. Apart from the region based inequalities, there are inequalities due to caste, class, gender that lead to unequal access to water. There is an urgency to address water issue, given that the rural population constitutes close to 70% of the population, which is confronted with poor sanitation and drinking water supply. The National Sample Survey carried out in 1998 revealed that almost 70% and 18.7% of urban and rural households respectively had access to piped water supply. The system of allocation of water depends on several factors such as the institutions, legal framework, the infrastructure, and so on. The responsibility of drinking water institutions in the urban and rural areas is quite indistinct to segregate their tasks respectively. The growing urban space in the developing countries has left the deprived communities to suffer from the inequities arising in the domain of improved drinking water in their households. The report by WHO in 2012 shows that the progress of drinking water and sanitation, that even today the rural areas lag behind as compared to the urban areas in terms of improved water supply. The report also further explained that though there has been a growth in the water supply to the rural areas from 64% in 1990 to 73% in 2004, is still enormous number of 900 million people have not been covered till now. Importantly, the report analyzed that this situation could lead to the coverage of 80% in 2015, but with 700 million people still uncovered by the end of this same year. The above data shows that allocation of improved drinking water will be a bigger challenge by the end of 2015, leading to major population untouched by the equitable services of quality of drinking water. With the question of equity, the major thought is of the quality in the allocation of the same. Even in 2017, the scenario may be still same if we do not take proper measures about these water issues.
Caste based discriminations with regards to water. The study conducted by Christian Medical College of Belur district, they have studied a Nanvai village in the Belur district and found that village was divided into two parts. One part was called the main village, which was consisting of mostly upper caste people. The another village called Harijan colony, which was consisted of scheduled caste people. The main village population is 41% and the Harijan colony's population was 59%. And it was very surprising to know that the water supply in Harijan colony is 20 minutes per day, whereas it is in the main village 2 hours per day. and the water tank gets clean once in a month in a Harijan colony, whereas it gets cleaned twice in a month in main village. And when they have compared the taps, they have found out that most of the taps in Harijan colonies was dry. Another study conducted by Monch in 1998 in Marwa region of Rajasthan said that though ethically, legally and morally water is not denied to anyone, but most of the lower caste people waits in the village well to first upper caste people fills the water and after that they takes the water. So, this is the situation in India, but even in globally 260 million people are discriminated with regards to access to safe drinking water.
Drinking water and public health. Drinking water is the water consumed by human being in order to sustain the natural action of the body. Importantly, there is a very direct linkage between the drinking water and health. The quality of water used has a deeper impact on the health of the people. Water, when unfit for drinking, leads to different kinds of health related problems, which can aggravate with time. In fact, the quality of water depends on various factors such as the source of drinking water, location of resources, the storage system of drinking water, etc. Apart from the source of drinking water, it is a storage which affects the health. Most of the time, drinking water, when stored in an inappropriate condition, it may leads to contamination of water, which ultimately shows impact on the health of the general people. Importantly, the substitution of water is not possible and its scarcity at the global level is quite visible today. Let us talk about now the end part of this module is summary. It is not only the availability of water that guarantees life, but it is also its quality which ensures life free of health risk for people those who are using it. According to Lee and Scrub 2005, they said that the presence of public water distribution network is often an indicator of improved water supply in a developing country. It should not be assumed that the resulting water quality is always adequate for human consumption. Access to safe water reduces exposure to waterborne disease and death. Financial savings accrue from good health through reduced expenditure on health care and limited loss of working days due to ill health. In India, diarrhea and respiratory infection are the major cause of children death in India, which occurs because of non-availability of safe drinking water and poor sanitation condition. Again, as much as provision of clean water is important in the control of waterborne disease, it also plays a huge role in eliminating disease related with inadequate unhygienic practices. The water supply in the urban as well as rural area may not necessarily indicate the cleanliness and the fact that it may be of a drinkable quality. Lastly, the challenge of uninterrupted access to safe drinking water still exists in most part of the country. It is important to measure its effect on health of the people. Therefore, the government and other stakeholders related to this area has a pivotal role to play together, so that the drinking water and the safe drinking water we are talking about should reach to the common man.
Often we read in the advertisement or see in the public places that Jal hi Jeevan hai, clean water is life. But I think that the slogan should be replaced with Shuddh Jal hi Jeevan hai, clean water is life, because we know that millions of children and people are dying because water related or waterborne diseases. Thank you.